Good evening, everyone. Welcome to another special edition of the Apex of Training and Development show. I am Cherian Casimir Hudge, and I'm delighted to be your host for this evening's show. The Apex of Training and Development has once again partnered with Community Charitable Ministry and the Antigua Barbuda Cancer Support Community to present Cancer Awareness Season 2. This series is brought to you by Sagicor Insurances. And Nagico is one of the leading insurances across the Caribbean, and they are located in 21 territories. Now, tonight we have two very special guests, and they're none other than Nurse Imelda Benjamin and also Romancia Kit, mother of Micah Kit, who would have recently passed on from cancer. And they both reside in the island of Antigua and Barbuda. Good evening, ladies, and welcome to the show.
Good evening.
All right, Nurse Benjamin, we're going to begin with you. For persons who may not be familiar with you and your story, tell us a little bit about yourself and why is cancer awareness of such great interest to you?
Okay, good evening, everyone. My name is Imelia Benjamin, as would have been said. I am a 4 years breast cancer survivor. I am a registered nurse. After I would have gone through my cancer treatment, um, coming in contact with other cancer survivors and realizing that a lot was missing from the treatment in terms of psychosocial support, and that's where I came in offering this added support to persons diagnosed with cancer. And more so, I come to realize that in Antigua we celebrate breast cancer a lot and also prostate, but there's so many cancers and other persons with other cancers that do not have that support, and that's where I came in forming my support group, the Antigua and Barbuda Cancer Support Community. And that's where I would have come in contact with Romancia and many others who were touched by cancer.
All right, Nurse Benjamin, thank you so much for this introduction of yourself. And we also have Romancia Kit with us. She is the mother of Micah Kit, and her son, a toddler, recently passed on from cancer. So, Romancia, tell us a little bit about yourself and your journey being the mother of a cancer patient that was a toddler.
Good night. I'm romantic kid. Well, I had my son Michael Kate was diagnosed with cancer at 4 months and has battled and overcome it, and he came back about a year after him after he was cancer free. He went back in remission after a year, so it was a very difficult journey. Um, it's still very difficult to talk about, but that's who I am and that's my story so far.
Thank you so much. For those of you who are joining us via any of our social media platforms, I would like to encourage you to share the live, tell a friend, tell a family member that we are speaking about cancer. So join us and listen every Sunday as we continue the discussion. Nurse Benjamin, last month well, 2 months ago, we had season one of the Cancer Awareness Program. And for the first time ever in Antigua and Barbuda, we would have celebrated Cancer Survivors Day, and you would have been instrumental in promoting Cancer Survivors Day. Tell us about that experience.
Okay, so after being diagnosed with cancer and everything about cancer, you gravitate to. So I become aware that there is a Cancer Survivors Day. Actually, there is a Cancer Survivors Month, which is the month of June. And then after I would have started my cancer support group via WhatsApp in 2020, I was trying to really get it to launch really out there. And so the idea came, why not use Cancer Survivors Day, which would have been the first Sunday in June, June 6th this year. So why not use June 6th, Cancer Survivors Day, to bring awareness to this day in Antigua and Barbuda? Because from my memory collect, I have never heard of Cancer Survivors Day being celebrated in Antigua and Barbuda. So I started pushing awareness for Cancer Survivors Day and actually launched my support group, the Antigua and Barbuda Cancer Support Community, on June 6th of 2021, which is National Cancer Survivors Day.
And what was the response like from the public?
The response was awesome. And, lots of persons came on board. We had our launch. We identified survivors. We had shirts, and it. I would say it was good for first because, but I find that the public catch on, and lots of persons were becoming aware of Survivors Month, Survivors Day, and I can see it getting bigger next year.
Awesome. Now, Romancier, what was your son like? Because he stole the heart of the nation of Antigua and Barbuda with his story. But what was it like being the mother of Micah?
Um, Michael was very energetic. He was full of life. He he brought joy to anyone that came close to him. Michael was very playful and active. Um, he was like any other normal toddler. Seeing him, you would have never thought that he had cancer or what, the experience that he had gone through because he was always joyful and happy. Um, so
And when you found out he was diagnosed with cancer, what sort of emotions were evoked when you heard such a devastating news?
well, it was very like the emotions. It was very emotional. I didn't expect to hear that, especially from a small child. Um, I wasn't aware at that time that children even got cancer at that age.
Hmm.
But it was already at stage 4 when we found out. Um, the cancer has been growing in him while I was pregnant with him. So it already had spread to other organs in the body. The body had accepted the cancer because it has been since he was in the tummy that the cancer was there. So the body didn't reject it at the first when it came first. Um, it was very devastating. It was challenging. It was yeah, but I trusted God, and God worked it out and gave him some more time that I truly appreciated spending more time with him. But um, it was a tough battle, a tough battle. I'm just thankful for the time that I actually got to spend with him. He was a very strong baby. He had a lot of courage, and he was brave, and you know, very friendly and playful and active.
Wow. Very great memories of the late Micah Kit. Nurse Benjamin, we're now on season 2 of the Cancer Awareness Program, and we are spreading our wings across the Caribbean as far north as Bermuda to as far south as Guyana. What can persons expect to get from season 2 of the Cancer Awareness Program?
Okay, in season 2, we're encompassing September, October. So we're in the
Well,
month of September. And in this month, there's about 7 cancers that are highlighted within the month of September. And then we know October is breast cancer. So in September, usually we only hear about prostate in September, and recently um, pediatric department at Mount St. John started highlighting childhood cancer because we had Micah and a few others children who were diagnosed with cancer. So they started bringing awareness to childhood cancer. Prior to that, we only heard about prostate in September. And so I have decided in my group that we are going to bring awareness to other cancers. And these cancers are, we have ovarian cancer, which we have a very well-known young lady, um, Leeward Island cricketer Sherma Jackson recently passed from ovarian cancer. And there are quite a few other young people who passed from ovarian cancer in Antigua and Barbuda. We have leukemia. We have quite a few young persons diagnosed with leukemia. We have lymphoma. We have uterine cancer. That's one of the gynecological cancer, which is this ovarian falls under. And of course, we have childhood and we have prostate and we also have thyroid cancer. You know, these are cancers that we don't really hear about, but actually, there are people in Antigua and Barbuda that are survivors of these cancers. And we want people to become aware of these cancers, to know the signs. We want people to become aware of the screening because, you know, early screening, early diagnosis gives you, you know, a better chance of survival. So we want to educate the public on all these cancers that are out there and they're affecting lives and they're touching more and more younger persons. And some of these cancers, they're not easy to pick up. But we want people to be aware and we want the few persons in Antigua with those cancer, we want them to know that there's support. You don't have to be alone in your own little corner, not really having anybody to talk. We want you to know that there are others in your situation. And if you get in touch with us at the Antigua and Barbuda Cancer Support Community, you will find an awesome support group there that will help you along the journey of your cancer survivorship. My
And could
let
you
me hear.
highlight some of the guests we can expect to see on season two?
Okay, we have an awesome array of guests. Last season, we would have had Dr. Ephraim, he's coming back. We would have had Dr. Hannibal Yaziji, Dr. Nandan Shanbag, head oncologist from Mount St. John. Um, we are bringing on board Corinne Norton, social worker, to deal with the psychosocial aspect. We are bringing on a physiotherapist, Andre Peter, and we are also having a few other survivors. We're having a leukemia survivor. We're having a childhood survivor who is in primary school now. She's going to share her story. We have family members of persons who would have passed from cancer who would share their experience in dealing with their family member being diagnosed and eventually dealing with their death. So it's a rich panel that we have for this season.
Okay, and I know in June, during the Cancer Survivors period, well, on Cancer Survivors Day, I know you and the Community Charitable Ministry went out and donated gifts to cancer survivors. And I was also told recently that some of them have since passed on. Tell us a little bit about that experience.
Yes. So back in June on Survivor Day, I chose a group of cancer survivors to bring a little cheer into their lives. These are persons who majority of them were stage 4 terminally ill with cancer. But we were still hoping that they would still be here with us. We just wanted to bring some cheer into their lives, but they would have lost the battle, they would have gained their wings. And so I would like to dedicate this season to the memory of Kareem Calico John. We had Adlit Bell, breast cancer. We had, as I mentioned, Sherma Jackson. She recently passed. Also had Fidel Roach, a good school friend of mine. He passed also, and we were able to bring cheer to him. And most recent, 10-year-old Adani Joseph. lost his battle to childhood cancer. We were hoping to celebrate with him this month of cancer survivorship. And we were able to bring a little cheer to him also and to his grandmother. And so our hearts and prayers are with the family of John and Joseph who recently passed. And they just ask the good Lord to give them the strength. It's not easy losing a child and losing a child to cancer. So that is why Antigua and Barbuda Cancer Support Community is here. So add that extra support, not only for the cancer patient, but also for the family member. And I know that Romance can speak to how supportive we were for her while she had to be in the hospital all those weeks. It's my turn.
All right, thank you, Nurse Benjamin. Romancea, now your son has passed on. What is it like moving forward, living with the memories of your son?
Um, Currently, it's still very, very difficult for me and my entire family. It's very challenging. We still wake up expecting to see his smile and his face. And, um, it's very difficult.
Do you think Micah's experience or journey, his short journey, God allowed it to happen for a specific purpose?
Um, Personally, I believe God allowed it, but I don't believe that it's something that He desired for him to pass. But He's still in control of everything, and He allowed it. I'm not sure how I feel about that currently. I'm still battling with a lot of emotions at this time, um, coping with the whole situation. So sure how I'm not sure how to answer that question at this time.
I understand. Nurse Benjamin, so you would have been instrumental in introducing the whole aspect of palliative care in Antigua and Barbuda. Tell us a little bit about this initiative that you're about to begin at the Celeste Bird Medical Center.
Okay, so as you know, I'm a nurse. I work at Mount St. Celeste Bird Mount St. John Medical Center. Being a cancer patient, I began working closely with other cancer patients. And the palliative care has always been there, but not in a way that was really benefiting the patients that required it. So I started making it my business to work with getting the family members and the patients that extra care that they required when you're terminal ill. And let me say here that palliative care is not only for persons who are terminally ill in a sense, or only for cancer patients. It's for anyone who at a period in their illness where they require a certain level of care. And so in Antigua Barbuda, we do not have a structured palliative care service, and that is where I came in, and Dr. Nandan, and we're trying to get that established here in Antigua and Barbuda. And so he would have been putting in words to the management of Mount St. John about the palliative care, us bringing it on board, and recently I was given that mandate to head that palliative care program at Mount St. John's Medical Center. So very soon, you will be hearing, the general public will be hearing more about our palliative care, national palliative care initiative here in Antigua and Barbuda for all patients, not just for cancer patients, but for patients with end-stage renal disease, patients with heart conditions, patient HIV, any anybody who is terminally ill, that service will be available to.
All right, it's good to know that it's not limited to cancer patients only. So, Nurse Benjamin, what's next for the Antigua Barbuda cancer support community?
Okay, so the anti-Barber Cancer Support Community, we are in our infancy stage. Because of the pandemic, what we are able to do is very limited. But we are growing, and we're hoping to expand our wings in the near future. And you mentioned how far-reaching our cancer awareness program is going to be. So I'm seeing us partnering with other cancer support organization across the Caribbean. As you mentioned Guyana, I actually have someone in Guyana who is a member of my support group, and she's very
Mhm.
active in my group. I also have someone from St. Lucia who is a part of my group, a cancer survivor, and they're very active in my group. So we're already out there, and we just want to spread a little more, and we want more and more persons in Antigua and Barbuda to be aware of the support that is available for them. I mean, you don't have to struggle alone as a family member with your loved one who is terminally ill. Not only terminally ill, just hearing that you are diagnosed with cancer, that is something that most persons can't handle. And it's like you don't really know where to turn. And I'm happy that my group is here, and they shower praises all the time in the group, how happy they are to have this support group that they can share with, that they can get encouragement from. And we are just like one big happy family. And I just want others to come on board and not having to go through cancer alone. It can be lonely, but knowing
Mhm.
that you have somebody who share what you share. When you say, I feel this way, and somebody say, I know what you're talking about.
Mhm.
I've been through that. Try this, try that. Oh, you're not crazy. I know what you're talking about. Because if I tell somebody who never experienced cancer or cancer treatment, they might think, she's crazy. What's she talking about? But if I'm talking to somebody who is a survivor, who have been there, done that, they will say, I know what you're talking about. And you will get over it. It will pass. Just be strong, just hold it together. And that's all it takes sometimes. Just knowing that somebody else appreciate what you're going through and can walk side you and hold your hand and be there for you is so very important. And persons are benefiting from it, and I want lots more to benefit from it.
Now, apart from having that support, having someone to speak to, what about financial support? Does the group offer financial support to persons that are unable to pay for their treatment? Because the last time we spoke with a cancer survivor on this show, that survivor highlighted how expensive it is to undergo chemotherapy. So, can you provide a little insight on financial support coming from your group?
Okay. Yes, let me say that in Antigua and Barbuda, we if once you are on the medical benefit, you actually pay for your treatment for the medication, but there are still expenses that are still incurred. Especially there's some medication that you'll have to buy. There are your monthly or bi-weekly blood tests that you would have to do, that you'll have to pay at the private lab. So sometimes you will have a cancer patient paying up to close to $300 every month or every 2 weeks on labs. And on top of that, you'll have to buy medications. On top of that, you have to change your diet. On top of that, we have the pandemic. Some people are not working, their jobs are affected. So here's where the support group comes in. We are, as I say, we are new, we are small, but we try and we raise some funds. I tap into sources that I know will help, and we assist persons with their getting their labs done, if they have to go to the cancer center for their consultation, and that's the fee that you have to pay from your pocket. Medical benefit doesn't cover that. And so we assist there. And so Antigua and Barbuda Cancer Support Society welcomes donations from corporate Antigua, citizens of Antigua and Barbuda. Anyone who can give us any support, we welcome it, because the situation is real. You heard the person spoke about it, and I'm telling you, it's real, and people are in need, and we are here not only to give that psychosocial support, but we're looking at it holistically, financially, and we know finance is important in health wise, and so that's why we are here and welcome all support that we can get.
All right, so I'm just going to touch on some of the comments we have here. We have a comment, well, good evening from Siobhan Stevens joining us in Canada. We also have a comment from Camelda Michael. Good evening. May God bless you. Keep you. Keep up. May God bless you. Keep up the good work. Thank you so much. And of course, tonight, once again, just to provide some insight on our discussion, we're discussing season 2 of the cancer awareness program that we have for the months of September and October. And we are also here with Mrs. Romancia Kit, mother of Micah Kit, who has passed on from cancer. So, Mrs. Kit, what advice would you give to any parent that that is presently experiencing something that you would have gone through with your son?
The advice that I would give them is keep trusting God, prayer. Keep praying. God can change any situation. Don't give up. Don't give up on the child. Just keep fighting and let the child know that you love them. Show love to the child. Children can actually sense when you're stressed, so keep your
Mhm.
stress level at very low. Um, Keep the child comfortable, and just keep the faith. Don't give up on that child. Just keep going.
But how difficult was it for you to keep your stress level low, eh, going through all the things you were experiencing with your child?
Well, I had a lot of faith, I must say, and I had support also from the cancer group and even the doctors at Mount St. John's, my church family. There was a lot of support. I had a lot of faith, even until the very end. I thought that he will come true. I never gave up on him, regardless of what the doctor might say, or the diagnosis, or the prognosis. I just keep believing that he will come true. So
And
I,
I
until the last moment when they say that he's completely gone, I still had the hope that he will be healed.
and I really do admire your faith and the importance you place on prayer. Nurse Benjamin, how important is the spiritual aspect in your group? Do you reinforce the importance of prayer and faith when persons are going through cancer or they're in a state of remission? What is that? How does that aspect play a role in the Antigua Barbuda Cancer Support Group?
Okay, spirituality, spiritual health is very important. We encourage prayer. We encourage, even when persons are hospitalized, and even with all the restrictions, I still go out of my way. I make sure that the patient's spiritual needs are met. So, if the person doesn't have a pastor, I would bring in a pastor that can pray with them, share with them. We, in our group, we share prayer, we share scripture, we share encouragement. We are very big also on mental health, because going through the stress of a cancer diagnosis and all that goes along with it, it's very easy for persons to become depressed. It's very easy, especially when you think you're doing good with the cancer, and then you go for a checkup and you hear the cancer is back. You hear the cancer somewhere else, and now you move from a stage 2 to a stage 4, and this can be very overwhelming, and this can cause someone to go into depression. And so we are very big on mental health. Every Monday is our mental health day, and so every Monday I will post, uplifting post in the group, encouraging persons to be positive and to do their mental health check. Take care of yourself, to do your own mental health check, and to look after yourself. And I say, without prayer, none of us would be here. So we are very big on prayer and the spiritual aspect of a person's life.
All right, for those of you who are joining us via any of our social media pages, feel free to leave a comment or ask our guests whatever questions you would like to ask them. Nurse Benjamin, any final remarks as we conclude tonight's session?
Okay, so yes, so the reason we are here and the reason there's an Antigua and Barbuda cancer support community, and that is because we want the persons with the other type of cancers, other than breast cancer, other than prostate cancer. I am a breast cancer survivor, but surrounded by the yellow, the orange, the lime green, the teal, the gold. I'm surrounded by the purple, and those are all the other colors of cancer survivors that are and they are right here in Antigua and Barbuda. And so I just want to encourage anyone out there, if you have been diagnosed with cancer, you have a support group. You can reach out to us at the Antigua and Barbuda Cancer Support Community by calling my cell number 722-1019. That's 722-1019. Or you can reach me at Mount John's Medical Center at the Oncology Department. Also, you can call 770-2954 if you need someone to talk to, if you have questions. We are here for you. If you need someone to guide you through the treatment, we are here for you. And we don't want it. Our motto: no one fights alone. We are family. You're not here. So we invite you to come on board and be a part of our family.
All right, we have a comment from Lily Fagan. She said, "Good night. Very interesting discussion." Awesome. Thank you so much, Lily Fagan, for joining us. And Mrs. Kit, any final remarks?
Um, I would just encourage everyone to support anybody that they know that are battling with cancer, even if it's just an encouragement. I also encouraging people to join the cancer support group. There's a lot of support there, a lot of encouragement, a lot of love being shown, and anybody that is battling, I just encourage them at this time to keep battling, don't give up, and anything is possible with God.
Amen. Very encouraging, Mrs. Kit. I really admire your faith and your spirituality. Now, tonight is a little bit shorter because the purpose of tonight's episode was to introduce you to the season 2 panel and what to expect for the upcoming season, which will run from September to October the 17th. And we will be streaming via 4 platforms every Sunday at 8 p.m. We'll be streaming live via Twitter, the Apex of Training and Development Twitter page, YouTube channel, Facebook, and LinkedIn. So feel free to join us. And next week, we will have Dr. Ephraim, and he'll be looking at ovarian cancer and all the different gynecological cancers. So come with your questions, your comments. I'm sure Dr. Ephraim will be more than happy to respond to them. Thank you so much for joining us. And remember to tell a coworker, tell a friend that the Apex of Training and Development and the Antigua Barbuda Cancer Support Community, as well as Community Charitable Ministry, has launched season 2 of the Cancer Awareness Program. Once again, thank you so much for joining us, and see you next week. God bless.
God bless.